guys, it's Becky. I'm just here to talk to you today about postmortem care. Kind of a sad topic, but it's something that somebody will probably have to do at least once in their nursing career. So there's a lot to cover, but the things that I think are most important, are how to do the body preparation, because everywhere that you look there's really nothing that actually shows you how to do it. So obviously hands-on would be much better than doing a video where you guys can ask questions, but this is what we're going to do for this go around, okay? So postmortem care is pretty much the same whether the patient is big or small. It serves several purposes, including viewing for the family, ensuring proper identification for the patient prior to transport to the morgue or the funeral home, and providing the appropriate disposition of the patient's belongings. For me, I think it's really important to continue to treat the patient as a patient. I often continue to talk to the patients as if they are still here. You just want to convey the most respect that you can to the family and to the patient, even after they're gone. So it's important to still call them by their name instead of the body. It'd be better to say, like, when Jonathan goes downstairs instead of when the body goes downstairs. So little things like that can help, and then just talking to the patient still as if they're still present in the room, which they kind of are, can help in your own comfort level, just to kind of keep you going on your routine. So the process of postmortem care is not difficult. It just takes, it's time consuming and it's very emotional. One thing that's important to set up in your room beforehand, before you even get to this stage, is that you really would like to have a curtain in the room. It's kind of an odd thing to think about, but if you know that the patient is getting near the end of death and they do not have a curtain in their room, I would encourage you to have somebody come in and put a curtain up. It only takes a few minutes to do it. You don't want to be doing it at the end of life, at those last moments, and disrupting the family. But it can provide some privacy while you're doing like wrapping of the body that the parents may not want to be present for, and they may not want to leave the room. So you can provide that divider to kind of give you some privacy for those awkward moments. And then, you know, it just provides a little bit more privacy for the family as well. So the next things that you're going to want to do, I'm kind of looking at my list. You want to gather all your supplies. The first thing that you want to collect is, you want to call the morgue and let them know, and you're going to get your packet from the nursing soup if you don't have one already. The nursing soup is a good one to get this from because sometimes the numbers on this packet change. So inside of the packet, everything that you need to have in this packet, it'll walk you through in the binder that I have for end of life. So it tells you about the tags and how to prep them, and it outlines what the doctors need to do and what the nurse needs to do. The other things that you can get are your end of life box. This is a new box that we got. It's called the Legacy box. It's got some donated items in it. But the other box is this one back behind me here, and it's no longer purple, but it has a purple tag on it for bereavement, and it just has some excess items in there. Things that you'll find in these boxes are a little satchel for hair clipping, ink for doing the hand and foot rolling. The other ink that we have is this one. This is in the NICU for footprints. It looks like this, and you basically press their hand down into the paper on it. So it's a little bit trickier than the roller that we just got. So these were nicely donated through some hospital funding. We have these in the PICU, and we get a couple of them here as well. It's modeling clay. You want to try to grab 2 of the same color. On a baby you could probably use just 1, but on a bigger kid you definitely are going to need 2 to smush it and get it warm, and then you can set their hand or their footprint. If you can't get a good handprint because they have contractions, it's okay. You can just kind of do the best that you can do. Sometimes the side of the hand is a good one to get a good print of the, you know, the patient's original print is usually available on that side of the palm. The parents are going to know their kid if they have contractions. It's not like they're expecting a perfect handprint to come out of this. And some parents may not even want any of these things. So the legacy items are kind of separate. The other thing is this box, and this is also nursing soup or NICU, PICU has these, and we kind of take some of the items out depending on the age group. Back to the actual medical items, so back this thing, inside of here are your tags. You'll need a shroud pack, which the really nice one you can get from the morgue, that's this one. It's not thin and it won't rip. The other one, the see-through, and it will rip a little bit. What did they do with that one? Right here? No. Well, this is the other one, but there's a little explanation chart on how to wrap things that I'll show later. You know where that? Do you see it? No. And then inside of there are these ties, and sometimes the ties are different. This is a new package that looks a little bit different to me. There it is. It's a Medline shroud package. It's under bags by our patient discharge bags, and it tells you how to do the ties on here. On anyone that's under like 2, really you don't need to do the ties. On anyone older, it's more about thinking, is their mouth going to drop open? Is their hand going to fall out? So those kind of things are why you use the ties. So if you think that you can swaddle them well enough in a blanket and they're not going to lose their arm off the bed or anything like that, then they can just be in a blanket. And then one thing to remember about the blanket is, even though I have these nice warm honeycomb blankets on here, when you do your final wrapping, you want to make sure that it has not got any pattern on it. So sheet like this is just fine. Any of the blankets, like the bed blankets that have a pattern, you don't want to use those, because it's fine during warming, but during end of life care you don't want that, because it'll leave that imprint on the patient if they do like an open casket or anything, and you wouldn't want their face to be all patterned like that. Let me pause it. Action. So the ABD pads are the other thing that you're going to want to include. It's not in your kit, and those are going to go on all the orifices that are draining fluid. So you will put this on the front and back side of their perineum, and then if there was any drains that are staying in the patient, then you would put this on there as well. We can talk a little bit about some of the drains that would be left. Most of their lines that are able to be removed by nursing should be removed, as well as NG tubes. The only time that you would not remove all the items is if it was an autopsy or if it was a sudden death, like if we're doing a code. All the stuff that is done on a code needs to stay in if it was not a planned death. And that includes like IO needles and all those things. And in that situation, you want to cover them and secure them as best as you can, and then still provide some of this end-of-life care that can kind of cover up some of those things and give them a more natural-looking child, because that is obviously a super traumatic situation, and you want them to be able to have a chance to say goodbye without it being super traumatic. So let's see, what else? So leaving it in if they have an autopsy or it's emergent, and then taking it out, it's kind of the preference of the family when you decide to do that. I had one family that wanted it taken out before the child passed away, so in that last 24 hours we started removing everything until we didn't need that oxygen on that last nasal cannula. We took the tape off and let them pass more naturally without the oxygen. The IV, obviously we want to think about that ahead of time if they're wanting to remove the IVs. Those sometimes are things that are nice to keep in. The central lines are great for embalming, so it's why it's important to have these conversations with families beforehand, because it's stuff that, as horrible as it is to talk about these things, they may be really adamant about them, but at the same time it might be more helpful for the care of their child after passing. But if they want it, then don't have that struggle at that moment. We can figure it out otherwise. Trachs will leak, often during a code if it was traumatic, if they had to trach somebody or they were trached. There could be blood coming out, or if they were intubated and it was not a smooth procedure. So just thinking about those things that you can cap off and try to make it look less traumatic for the family. But anyway, so these pads are going to go on to protect those areas and collect the fluid. And then we don't put anything over the face really, so we just make sure the eyes are closed. If you're having trouble closing the eyes, there's tips in the book about what you can do to get the eyes to close. And we don't put tape over the eyes at all. So we're going to position them as best as we can. We're going to make them look good. So head of the bed up at 30 to help with those draining fluids. Obviously some children look absolutely horrible at end of life and others don't. They may have purpura, they may have bled out. So those are the kind of things that the doctors are thinking about ahead of time, about meds to give or not to give that could cause them to look absolutely horrible at death, or save that parent a little bit of looking at a child that is purple. So even though we're not always thinking about those things, sometimes our docs are. But so you're gonna try to make them look as good as possible. You're gonna clean them up, you're gonna do a bath. So you've got your soap, your cloths, and this is the point where you can involve the family. You would clip the hair during this time. Ask them if they would like to help with the bath. Try to make it as non-medical as you can. You should be wearing gloves during all this, but the family obviously does not need to be wearing gloves unless there was something really contaminating about their death. So what else can we cover? We did the tubes. So put them in whatever clothing the family wants. So if it's a christening gown or something like that that they want to have that's special, they can do that. We have some very special items in the box behind me for babies more so than for kids. If you have like a trauma that comes in and there's no clothes, we do have some donated items in the stuff for foster kids that we can occasionally use. And sometimes they do want those last photos holding their baby that's passed, and those are nice that you can do that for them if that's what they want. So just know that everybody has their own level of comfort with what they're wanting. So you want to make sure you turn off the bed. A lot of the patients at end of life have really loud beds for bed sores, and thinking ahead, if you turn off the bed, is it going to bottom out? Do you need to get a gurney in there instead to move them over? A good time to move them over and do things that maybe the family doesn't want to be there for are when you ask the family, to gather up the belongings. They can take the belongings out to the car in stages, and then you can do those things when the family isn't always there, where you can move them to there. Some families don't want to see the child going into the gurney, so those are things to think about. We like to leave the hands out if you can for the family to touch them. Now a baby, I only have a baby for example on here, but this is supposed to be a bigger kid. They would probably be on a warmer. You can add the French fry lights. They have them in the OR sometimes. I'm not sure what they're really called, but any warming light. I don't know how great these would work anymore, but our old ones were pretty good to help keep that body warm, because rigor mortis sets in anywhere from like 10 minutes to 6 hours. So just making sure that they are staying warm even with the blankets, so that when the family goes to touch their hand, they're not ice cold or they're stiff already. And then when we're ready, we can remove those warm blankets if they're the Waffle brand. So elevating the head, watching for rigor mortis, providing that warmth. You can turn up the room temperature a little bit. Obviously you don't want your family sweating. Provide easy access to Kleenex and make sure the garbages are there. And then you want to clean up the room and kind of make sure that everything's tidy, especially if it was a traumatic situation where everything is all over the place. You want to kind of clean it up and make sure that there's no leftover like sharps and supplies, and that it kind of is tidy for them to do a viewing of the patient.
Action.
Okay, so we've got the room cleaned up. The family is doing their viewing if they so choose at the bedside. You can give them space and just be available for questions. This is a good time if you are not super busy with other patient care. Hopefully we don't have you assigned to a full load. But sometimes it's not, sometimes there's no other options. But so you're trying to, give them their space, but answer questions if needed. The people that should be already on their way up and involved, obviously, the doctor should have called the time of death already, so that should have been done first. Some things to talk about with that are the doc can come in, you let them, you notice the patient isn't breathing anymore, they've passed, You can listen for a heartbeat yourself and make sure, and then you don't say anything. You just say, I'm going to go get the doctor. I feel like it's getting really close to time. And then let the doctor know. Sometimes the child will start breathing again, or their heartbeat will start beating again. So I never say anything for sure. And same with the doctors have maybe miscalled it. So, you know, sometimes the doc will come in. If he doesn't know what to do, you can say, you know, you can go in and listen and say you'll come back in 5 minutes. And that's a fine thing to do as well. The time of death is not going to really matter, especially if it's not a code. So if it's an anticipated death, then we're not in a rush to call the time of death. It's better to only have to call it once. So some other things that you can do, obviously the chaplain should be involved, social workers should be called. If they have their own home chaplain from their own church, that person should be reached out to. Any family members, these things should be discussed beforehand of like, hey, if this happens, who do you want me to call on those end-of-life kiddos? And then you also want to be calling PAD. They have a lot of the paperwork. They're going to come up and talk to them. And then if an autopsy is necessary, or they do the autopsy paperwork if it's necessary. The doctor that is calling the time of death cannot be the same doctor that does the autopsy paperwork. So just know that they have to be different doctors usually. It cannot be usually the diagnosing doctor that does the same paperwork for autopsy. And I don't understand all that either, but that's what I've heard. And then just making sure that if we can get like the chaplain's office can get donated food items, making sure they have, you know, coffee and water, all that stuff right available towards their rooms, so they don't have to come and go a lot if they're having a big family group. Obviously during COVID times, the limited visitors may be a situation that we'll have to talk to the leadership about. So once they've done their goodbyes and they feel like they're in a good place to either leave the hospital or help with the final procedure, usually most families do not want to do the wrapping, and I share that with them. You know, like, this is something you don't have to be part of. It can be kind of morbid and very clinical. Watching your child go into a gurney with a bag on is probably one of the worst visions to have in your head. But it's called the Cadillac. We get it from the morgue. We bring it up and it stays off to the side until it's needed. It is very large. You do not need that on a baby. You can have the mother go down to the morgue with the baby on the lap. Just make sure you call security to let them know that we're going to be bringing a baby that has passed through the hospital floor. And then you also are going to call the morgue and let them know before you come down. You know, you just want to make sure there's somebody clearing the elevators before these kind of things, because you don't want them to be in there with the Cadillac or the mom or dad and the baby, however you decide to do it. You can also use the bassinet, the little tiny roller one, or the little mini crib. Those are all good ways to get little people down to the morgue. But you don't have to use the Cadillac for a small child. I'm gonna pause it again. On the sheet, it'll tell you how to do the wrapping for a larger patient or for a bigger kid. And it talks about doing the wrists and the ankles and then wrapping around the body. So we're going to put these straps underneath first. I don't have it like that right now, but that is what you would do. And then you have the wrists together. You do not need to do this on a baby, but you should at least have the tags on there, and then at least one tag. But this is more for a bigger kid. So if it's a bigger kid, you're tying the wrists and the ankles together. You have a tag on the wrist, you have a tag on the toe or the ankle, and then you'll have a tag on the outside of the body. We'll do that next. Marlena, could you please sit down? If you're tying the chin, so the eyes are going to be closed, and this is only on a big kid. So it goes on the chin here, and it goes up. And then we do one more. And you would tie again, like towards the top or to the opposite spot of where it is. Okay? If if you think it's going to leave a mark, then you can bypass it. It's better to not leave marks. And then you've got your waterproof things underneath. On a baby, you really just need a Chucks. On a big kid, we talked about those abdominal pads. Those are gonna go where the orifices are. So we got that underneath there. Make sure they're all cleaned up. And then you're going to wrap them like this. So everything's out. You're gonna wrap. I usually pull one side up. Everybody's swaddled in there. We're gonna come down a little bit. So the head is usually the last thing that I cover. And you can say your goodbyes while you're doing this. Thank you for letting me take care of you. I'm gonna go like this. And then I usually fold this down and this way. And then you already would have your straps underneath. And then usually you need only like one for a baby and then two maybe for a big kid. And then you would just do your tie here. And you can cover the patient with a blanket if we have a donated blanket, and you can give that to the family afterwards. Your last tag is going to go on the outside. You've got your name bands on there, your stickers on there, right there. Okay. And then you do not need to leave the name band on the patient if you have your tags all on. So that is not something that has to stay. I would usually give those to the family. And then you would, you know, place the baby in the mom or dad's arms, whoever is going to go down. If they aren't comfortable going down, you can put them in the little bassinet and go down to the morgue. And somebody should have called already ahead of time. And then, you know, if they're walking out, we usually have a card that we've all signed for them. We can give them the blanket as they leave the morgue area if they wanted to go down there, or we can come back up with it. If you can walk them out to their car, that's a nice added thing. Sometimes the front door is a good spot though to break that relationship and say your goodbyes until another time. So just kind of, you'll know with the family and how well you know them and what feels the most comfortable to you. I hope that was helpful. There's a lot of information in the book, so please just check there. Thanks.
Does it look okay?
I can be a hippie.
Yeah, you can. Is it? Oh, it's recording, Becky.